Hi everyone, it's Wednesday, time for Wisdom Wednesday. Today I thought I would take the suggestion of one of my patients and talk to you a little bit about urinary tract infections, what causes them and ways to prevent them, and other ways perhaps to treat them as well. What we know about urinary tract infections is that they're one of the most common outpatient infections that we see. Very common. In fact, with the exception of the spike of younger women having them with their first encounter with intercourse, we see the prevalence of this really increases with age. And in women over 65, about 20% of women have recurrent urinary tract infections. And it's thought that between 50 and 60% of all adult women have had at least one urinary tract infection. And 10% of postmenopausal women have had at least one in the last year. We have seen quite a bit of this recently in our practice, so I thought I would kind of walk through that a little bit. We know that in younger women, it usually occurs at the onset of being sexually active because of the act of intercourse can introduce bacteria in through the urethra into the bladder. And it does take some time for the body to adjust to that change and for women to understand the need to empty bladder significantly after intercourse, even before and after. So we do see that. We do see urinary tract infections also can be associated with pregnancy, and we do screen for that quite a bit during pregnancy, and it can be quite devastating, and people can get really sick and develop what's called a kidney infection or pyelonephritis, not just a bladder infection, but pyelonephritis can be pretty significant if it's developed in pregnancy, and also later in life it can require hospitalization up to 7% of the time. So it can be quite a problem, and we know that with aging, we see this in older women depending on their health status, depending on whether or not they have to be instrumented with catheterization or not, because that certainly increases the risk for infection. We know that there's a history of higher incidence of urinary tract infections in patients with diabetes and with spinal cord injury, that type of thing, women who are not as mobile. So it is quite common. And for the most part, most uncomplicated urinary tract infections really are infections with an organism called E. coli. However, in women who have a compromised immune system or with a history of either having to be instrumented with a catheter or with diabetes, we see other organisms start to kind of crop up. And it's thought that actually 1/4 of women all have what we call group B strep that is just part of their normal bacteria. And usually that does not cause infection, but in some women, they can become symptomatic. So in respect of treating women with urinary tract infections, we find that we don't really need to use long-term antibiotics. Usually 3 days is enough. However, in some women who are having recurrent infections, we do need to use antibiotics for a more prolonged period of time, and understanding that we need to find the right and correct antibiotic as well. But we know that that generally the E. coli is fairly sensitive to antibiotics that generally don't cause a lot of problems with subsequent yeast infections. They tend to be very sensitive to macrobid, which is generally thought to be just an antibiotic for the urinary tract infection. Macrodantin or nitrofurantoin, if you will, all are the same medication. Occasionally we have to go into either the penicillins, ampicillins, occasionally into the cephalosporins, and then they can also be very sensitive to sulfa drugs, particularly Bactrim. But when we go into some of these other antibiotics, then women do get or are more prone to getting a yeast infection. So oftentimes we'll cover that. We also know that there are a couple of things that you can even get over the counter to help some of the symptoms. Now, the symptoms typically are either foul-smelling urine or real urgency and burning after urination are the most common frequent ones. So those types of symptoms, but we do like to at least get a sample of urine from patients so that we can culture that urine and can then identify the susceptibility of that organism to certain antibiotics. So that can be really helpful. I did want to mention, however, there is a product that can be quite helpful, and it's a sugar molecule called D-mannose, and it is from cranberries, and it inhibits the ability of particularly E. coli to attach to the bladder wall. Now, the bladder is what's considered a hollow organ, just like our sinuses or our gastrointestinal tract, which are all susceptible to basically the outside of our body. So any of the bacteria that can get in can set up shop, and we want to try to minimize that. And that's what D-mannose can do, is it coats, it's first of all concentrated when you take it orally in the bladder, and it all then does not allow E. coli to set up shop, if you will. But it needs to be taken fairly regularly, and it needs to be taken generally in a powder form, not capsule form, so that you can get enough. It has been shown in some instances to be able to treat a bladder infection, but generally speaking, we do have to resort to antibiotics and use the D-mannose more as a preventive. So what are the things that you can do to try to prevent bladder infections? Well, always for women, particularly wiping from front to back rather than from back to front to prevent any bacteria from the rectal area coming forward. It's important that you stay hydrated, drink lots of fluids. Important that you empty your bladder significantly. What happens is particularly as we age and with perhaps prolapse of the bladder, we don't empty as well. And so urine can stay in the bladder and therefore be more of a susceptible culture for bacteria. So what I tell a lot of folks is sit down, empty your bladder, stand up, and then sit back down and see if you can empty even more if you have frequent bladder infections. It's important that you don't hold your urine for long periods of time. So empty as often as you need to. Be sure to urinate before and after intercourse. And it's important that you avoid a lot of scented products, scented tampons and scented douches and or sprays that can disrupt the normal biome of that area. Probiotics can be very helpful in reestablishing a normal, healthy vaginal and vulvar microbiome. It's important that for women who have frequent bladder infections, we often will prescribe a low dose of nitrofurantoin or macrobid after intercourse to just help prevent recurrences. So that can be helpful for some women. And you can consume cranberries. Now, again, it's not a treatment, but it does have this D-mannose sugar in it, which can be concentrated in the bladder and therefore limit the amount of growth, in particular of E. coli, which is the most common organism causing urinary tract infections. So again, the D-mannose is a product. We have a product through Zymogen here called Tract that you can take 1 or 2 scoops. It's a powder, and you can take that as a preventive if you tend to have frequent infections, or you can just buy it in bulk and take 1 or 2 grams every day just to try to prevent urinary tract infections. Hopefully that's been some insight for you, and I hope you all stay healthy and well, and we will follow up again next week. Have a great week, and I guess we will talk again before Thanksgiving, but if you don't get a chance to see us, then you all have a happy Thanksgiving.